Top medications that can cause dementia. Imagine one day waking up and realizing that you can't remember simple things like your grandchild's name or where you left your keys. You may think it's just part of aging, but what if it's not? What if it's something more serious? Dementia, a term used to describe a group of cognitive disorders, affects millions of people around the world, and the numbers are only increasing. In fact, it's estimated that over 55 million people globally are living with dementia, and that number is expected to rise to 78 million by 2030. The consequences of this disease are devastating, not only for the individuals, but also for their families. And while most people know dementia can be caused by aging or genetics, other lesser-known factors can contribute to the development of this disease. One of the most concerning is medication, as some commonly prescribed drugs can have serious side effects that may lead to cognitive decline. Today, we're going to talk about 7 medicines that could be putting you at risk for dementia, and why it's so important to be aware of this potential link before it's too late. The first on our list is a class of drugs known as anticholinergics. Anticholinergic drugs are commonly prescribed to treat a variety of conditions, such as allergies, sleep disorders, motion sickness, and even incontinence. Some of the most well-known drugs in this class include diphenhydramine, often found in Benadryl, promethazine, Phenergan, and dimenhydrinate, Dramamine. While these medications provide relief for symptoms like sneezing, itching, and nausea, their potential impact on cognitive function should not be overlooked. The primary mechanism of anticholinergic drugs is the blocking of acetylcholine, a neurotransmitter that plays a crucial role in several bodily functions, including memory, learning, and muscle movement. Acetylcholine is essential for communication between nerve cells in the brain, especially in areas involved in memory formation and recall, such as the hippocampus. When these drugs reduce acetylcholine activity, the brain becomes less efficient at processing and storing information. This can manifest as confusion, difficulty concentrating, and short-term memory problems. Over time and with continued use, the effects on cognitive function can become more severe, leading to long-term memory loss and, in some cases, dementia. Research has highlighted the risks of chronic use of anticholinergic drugs, particularly in older adults. Studies suggest that people who use anticholinergic medications regularly are at a significantly higher risk of developing Alzheimer's disease and other forms of dementia. The danger of cognitive decline caused by anticholinergic drugs is especially pronounced in older individuals because the aging brain is already more susceptible to damage. The ability to regenerate neurons and maintain efficient brain function decreases with age, which means that the cumulative effects of anticholinergic drugs may have a more significant impact as the brain's natural ability to compensate diminishes. The use of multiple medications, a common scenario for elderly individuals who often take drugs for a variety of health issues, can compound these risks. It's important for individuals who are taking anticholinergic medications to be aware of the potential long-term consequences on brain health. If you are prescribed these drugs for conditions like insomnia, allergies, or motion sickness, consider discussing alternatives with your doctor. There are often safer options available, such as non-sedating antihistamines for allergies or cognitive behavioral therapy for sleep disorders, which do not interfere with acetylcholine levels in the brain. Regular monitoring of cognitive function, such as through memory tests, can help catch any early signs of mental decline before it becomes more serious. Next, we have benzodiazepines, such as Valium, Xanax, and Ativan, are among the most commonly prescribed medications for managing anxiety, insomnia, and other conditions related to stress or tension. While they are effective in providing quick relief and are often used as a short-term solution, their long-term use raises serious concerns about brain health, particularly when it comes to cognitive decline and dementia. These medications work by enhancing the effects of gamma-aminobutyric acid, GABA, a neurotransmitter that has a calming, inhibitory effect on the brain. GABA plays a crucial role in reducing neuronal excitability, which helps to relieve symptoms of anxiety and promotes relaxation. Essentially, benzodiazepines amplify GABA's natural action, helping to reduce the overactive neural activity associated with anxiety and sleep disturbances. While this mechanism may bring immediate relief, the downside of relying on benzodiazepines for extended periods is their impact on the brain's long-term health. Over time, the brain becomes accustomed to this enhanced GABAergic activity, which can lead to physical changes in the brain. One of the most concerning effects is the shrinking of the hippocampus, an area of the brain that is integral to memory formation and cognitive function. As the brain becomes more dependent on the medication to regulate GABA levels, it reduces its ability to maintain normal GABA activity. This creates a vicious cycle where the brain's natural processes are disrupted, resulting in cognitive impairment, including memory problems, difficulty concentrating, and slower processing speed. The exact mechanisms behind this increased risk are still being studied. However, chronic benzodiazepine use is believed to cause alterations in brain structures and functions that contribute to cognitive decline. The drug's sedative effects also reduce neuroplasticity, which is the brain's ability to adapt and form new connections. This is critical for maintaining memory and learning abilities. Furthermore, the long-term use of these drugs can lead to dependency. When the medication is reduced or stopped, withdrawal symptoms can occur, leading to even more stress and further compounding the cognitive damage. Third on our list is antipsychotic medications. Antipsychotic medications, such as Risperdal, risperidone, and Seroquel, quetiapine, are indispensable tools in managing severe mental health conditions like schizophrenia, bipolar disorder, and treatment-resistant anxiety. These medications work primarily by targeting neurotransmitters in the brain, specifically dopamine and serotonin, to help stabilize mood, reduce psychotic symptoms, and improve overall functioning. While they are often life-saving for individuals with serious psychiatric disorders, their long-term use raises important concerns about cognitive health, particularly in older adults. The primary mechanism of antipsychotic medications involves the modulation of dopamine, a neurotransmitter closely associated with reward, motivation, and cognitive function. In conditions like schizophrenia, there's often an overactivity of dopamine pathways, which these medications suppress to alleviate symptoms like hallucinations and delusions. Similarly, serotonin regulation helps improve mood and reduce anxiety. However, the prolonged suppression of these neurotransmitters may inadvertently impair neural communication and lead to long-term cognitive changes. One of the populations most vulnerable to the cognitive effects of antipsychotics is older adults, particularly those with pre-existing cognitive impairments or conditions like Parkinson's disease or Lewy body dementia. In these individuals, antipsychotics are sometimes prescribed to manage symptoms like agitation or hallucinations, but they come with a significant risk. Older adults metabolize drugs differently, and their brains are often more sensitive to the effects of medications. This can lead to exaggerated side effects, including confusion, sedation, and memory impairment, which may accelerate cognitive decline. Moreover, long-term antipsychotic use has been associated with an increased risk of developing dementia. Some studies suggest that these medications may disrupt the brain's ability to repair and regenerate, leading to cumulative damage over time. While antipsychotics are sometimes necessary for managing severe symptoms, their potential impact on brain health underscores the importance of careful and judicious use. In some cases, alternative treatments, such as psychotherapy, behavioral therapies, or medications with fewer cognitive side effects, may be explored. For example, cognitive behavioral therapy, CBT, can be a valuable tool for managing anxiety and mood disorders, and mood stabilizers like lithium may provide an alternative for bipolar disorder patients. Another culprit is proton pump inhibitors, PPIs, such as omeprazole and lansoprazole, are widely prescribed for managing acid reflux, heartburn, and conditions like peptic ulcers. By effectively reducing the amount of stomach acid produced, these medications offer significant relief from digestive discomfort and prevent complications like esophageal damage. However, the convenience of PPIs comes with potential long-term consequences, particularly for brain health. The primary action of PPIs is to inhibit the proton pumps in stomach cells, which produce hydrochloric acid. While this reduction in stomach acid helps alleviate symptoms and heal ulcers, it also affects the absorption of key nutrients that depend on an acidic environment for proper digestion and uptake. Two of the most critical nutrients impacted by PPI use are vitamin B12 and magnesium, both of which play essential roles in brain health and neurological function. Vitamin B12 is vital for maintaining healthy nerve cells and producing DNA and red blood cells. If left untreated, a vitamin B12 deficiency can lead to neurological issues, including memory problems, confusion, and even irreversible nerve damage. Studies have indicated that long-term PPI use reduces the absorption of vitamin B12, as stomach acid is necessary to release the vitamin from food. Low levels of B12 have been linked to an increased risk of cognitive decline and dementia, making this a serious concern for those on prolonged PPI therapy. Similarly, magnesium is crucial for numerous biochemical processes in the body, including the regulation of nerve and muscle function and the maintenance of healthy brain activity. PPIs have been shown to interfere with magnesium absorption, potentially leading to a deficiency over time. Low magnesium levels can disrupt synaptic function and the transmission of signals in the brain, which are essential for memory and cognitive processes. Chronic magnesium deficiency has also been associated with increased inflammation and oxidative stress, both of which are linked to neurodegenerative diseases like Alzheimer's. For individuals who rely on PPIs to manage digestive conditions, it's essential to weigh the benefits against the potential risks. If you have been using PPIs for an extended period, consider discussing with your healthcare provider whether it's possible to reduce the dosage, switch to a different medication, or incorporate lifestyle changes to manage symptoms. Simple steps like avoiding trigger foods, eating smaller meals, and not lying down immediately after eating can significantly reduce acid reflux without the need for high-dose PPIs. The fifth medication to be aware of is statins. Statins, including atorvastatin and simvastatin, are widely prescribed medications for lowering cholesterol levels and reducing the risk of heart disease and stroke. They work by inhibiting an enzyme called HMG-CoA reductase, which is critical for cholesterol synthesis in the liver. By reducing cholesterol levels, statins can significantly lower the risk of cardiovascular events, making them a cornerstone in the treatment of heart-related conditions. However, concerns about their potential effects on brain health have emerged, particularly with prolonged use. Cholesterol is important for cardiovascular health and plays a crucial role in brain function. It is a fundamental component of cell membranes and is essential for the formation and maintenance of synapses, the connections between neurons that facilitate communication in the brain. The brain contains about 25% of the body's total cholesterol, emphasizing its importance in cognitive processes such as learning and memory. Statins reduce cholesterol levels by inhibiting HMG-CoA reductase, the enzyme responsible for cholesterol production. While this is beneficial for cardiovascular health, it also reduces the production of other compounds derived from this enzymatic pathway, such as coenzyme Q10, CoQ10, CoQ10 is a vital antioxidant that protects cells, including neurons, from oxidative damage and supports energy production in mitochondria, the powerhouses of cells. A reduction in CoQ10 levels may impair mitochondrial function and increase oxidative stress in the brain, potentially contributing to cognitive impairment. Research has suggested that individuals taking statins may experience memory lapses, confusion, or slower cognitive processing, particularly in the early stages of treatment. There is also ongoing debate about whether statin use is associated with an increased risk of dementia, including Alzheimer's disease. However, it's important to note that the evidence is mixed, with some studies suggesting no significant link and others even indicating a protective effect against neurodegeneration. Additionally, variations in statin types, lipophilic, fat-soluble, statins like simvastatin, and atorvastatin versus hydrophilic, water-soluble, statins like pravastatin, may influence their ability to cross the blood-brain barrier and impact cognitive function. Supplementation with CoQ10 is another option that may help mitigate potential side effects of statins. CoQ10 supplements have been shown to support mitochondrial function and reduce oxidative stress, which could help counteract the reduction caused by statin therapy. Combining this with a diet rich in brain-healthy nutrients, such as omega-3 fatty acids, antioxidants, and B vitamins, may further support cognitive function. Next, we have corticosteroids, such as prednisone, are powerful medications commonly prescribed for managing inflammation and autoimmune conditions like arthritis, asthma, and lupus. By mimicking the effects of cortisol, a hormone naturally produced by the adrenal glands, corticosteroids help to suppress overactive immune responses and reduce inflammation, providing relief from pain and other symptoms. However, while effective, these medications can have significant effects on brain function, especially with long-term use. The primary mechanism of corticosteroids involves their ability to modulate the immune system and inflammation by interacting with glucocorticoid receptors throughout the body, including in the brain. While this action is beneficial for controlling inflammatory diseases, prolonged exposure to high levels of corticosteroids can disrupt normal brain function. Cortisol plays a role in stress responses and is critical for maintaining homeostasis, but chronic exposure to elevated cortisol, or its synthetic equivalents, can have neurotoxic effects. One area of the brain particularly affected by corticosteroids is the hippocampus, a region vital for memory formation and emotional regulation. Studies have shown that long-term use of corticosteroids can lead to hippocampal atrophy or shrinkage, which may impair memory and cognitive processing. This atrophy is believed to result from increased oxidative stress and reduced neurogenesis, the process by which new neurons are formed. Over time, these changes can contribute to cognitive decline. They may increase the risk of dementia, particularly in older adults who may already be vulnerable due to age-related changes in brain plasticity. Corticosteroids can also affect mood and mental health. Many individuals on these medications report experiencing symptoms such as confusion, irritability, or difficulty concentrating. In some cases, high doses or prolonged use of corticosteroids have been associated with more severe neuropsychiatric effects, including anxiety, depression, and even steroid-induced psychosis. These mental health challenges can further compound the cognitive difficulties caused by the medication. Research has also highlighted a potential link between long-term corticosteroid use and an increased risk of developing dementia, including Alzheimer's disease. Although the exact mechanisms are still being studied, it is thought that chronic inflammation suppression combined with direct neurotoxic effects may contribute to this risk. Moreover, corticosteroids may interfere with other hormonal systems in the body, such as those involving insulin and glucose metabolism, which are known to affect brain health. In some cases, alternative treatments or adjunct therapies may help manage underlying conditions while reducing reliance on corticosteroids. For example, immunomodulatory drugs or biological therapies may offer targeted approaches for autoimmune diseases without the broad systemic effects of corticosteroids. Lifestyle changes, such as adopting an anti-inflammatory diet, engaging in regular physical activity, and practicing stress reduction techniques, can also support overall health and reduce the need for higher steroid doses. Finally, we have antihistamines, such as Benadryl, diphenhydramine, and Zyrtec, cetirizine, are widely used to alleviate symptoms of allergies, colds, and hay fever. These medications work by blocking histamine receptors in the body, particularly H1 receptors, which mediate allergic reactions like sneezing, itching, and swelling. While highly effective for managing allergy symptoms, certain types of antihistamines, particularly first-generation sedating antihistamines, can have unintended effects on brain function, raising concerns about their long-term use. First-generation antihistamines, such as diphenhydramine, are known for their sedative effects. These effects occur because these drugs easily cross the blood-brain barrier and interact with receptors in the central nervous system. Once in the brain, they block histamine receptors, which play a role not only in allergic responses, but also in maintaining wakefulness and cognitive alertness. This interaction can lead to drowsiness, lethargy, and impaired mental clarity, making these medications unsuitable for individuals who need to remain alert during the day. More concerning, however, is the potential for some antihistamines to interfere with acetylcholine, a neurotransmitter essential for memory, learning, and cognitive processing. Acetylcholine helps facilitate communication between neurons in the brain, particularly in areas like the hippocampus and cortex, which are critical for forming and retrieving memories. By blocking acetylcholine activity, these medications can disrupt neural communication and impair cognitive function. Chronic interference with acetylcholine has been implicated in the development of dementia, including Alzheimer's disease, where a hallmark is a significant reduction in acetylcholine levels. Research has shown that long-term use of sedating antihistamines, especially in older adults, is associated with an increased risk of cognitive decline and dementia. While second-generation antihistamines like cetirizine and loratadine are less likely to cross the blood-brain barrier and generally do not cause significant sedation, it's still important to be cautious with their long-term use. Even non-sedating antihistamines may carry risks for certain individuals, particularly those who are already at an increased risk for cognitive issues due to age or pre-existing conditions. For those who rely on antihistamines to manage allergies, exploring alternatives can help reduce potential risks. Non-drug options, such as nasal saline irrigation, air purifiers, or hypoallergenic bedding, can minimize allergen exposure and alleviate symptoms naturally. If medication is necessary, discussing non-sedating antihistamines or other treatment options, such as nasal corticosteroids, with a healthcare provider can help strike a balance between effective symptom control and cognitive health preservation. The key takeaway here is that many medications we rely on daily could be affecting our brain health in ways we may not even realize. While these drugs can be incredibly beneficial for managing various medical conditions, it's crucial to be aware of the potential risks they pose, especially when taken long-term. Early awareness and making informed decisions about your medications are key to maintaining your cognitive health and preventing dementia. By working closely with your healthcare provider, you can find the best treatment options that minimize risks to your brain and overall well-being. Thanks for watching. If you found this video helpful, please like, share, and subscribe for more insights into your health and wellness. Take care, and see you in the next one.